What are your views on euthanasia? Do you believe it should be legalized?
Personally, my views about euthanasia is that it shouldn't be legalized. I think it's could be subject to a lot of abuse
Yeah.
by the individual involved in that situation and by the people around that particular person. So at this point in time, my inclination is not to legalize euthanasia.
From the medical profession, is there a general view held by you doctors about euthanasia?
I don't think there is a general view held by the medical profession. I think if you go out there and talk to doctors, each one would have a view about euthanasia, and a strong view at that. There would be a group of doctors who'd be advocating for it, supportive of it, might even have had at one point in time done it.
Yeah.
And there would be the other group wherein they are totally against euthanasia. And that could easily be explained by the fact that doctors were trained, we are trained, to extend life,
Yeah.
not to terminate life. And so I think, if you follow it, if you follow our training, it is, but natural for doctors to try to assist for someone to extend their life rather than terminating it. So I think my feeling is that majority of the doctors would hold that strong view.
Okay. Do you believe that a person should be able to say that his or her pain and suffering is too much to bear and have the right to be freed of that?
Yes and no. We always say that each individual has their own choice. They have they have options on different things, and one of them would be a choice about how they're treated. But at this, to a certain point, that choice, that option, should be bounded by what is legal, what is ethical. And currently, the view about euthanasia is, it is illegal in Australia. It has been legalized in some countries, in a few countries. It's, I believe, legal in some states in America.
Yeah.
But certainly illegal in Australia. The question, though, was pertaining to...
Like, do they have a right to kill themselves, pretty much?
Again, if we probably have to go back to that person asking to terminate their life on why they want to do it. There's probably reasons held by that particular patient or by that particular person on why they want to terminate their life. I'm pretty sure most of the reasons that they have, we as a medical profession should be able to offer something to alleviate that. Take, for example, if that patient is in pain. There's a lot of pain medications that we can offer, that particular patient. Is a patient depressed? And that may be, the reason why they're thinking that life is not worth living anymore, And again, we have psychologists, we have psychiatrists, we have antidepressants, that we can employ. We can ask them if they're a religious person. We can ask someone from pastoral care to talk to them about, about their views in life. And so, my view is that we have to find out why this patient is asking to be assisted in dying, and go from there, and try to treat whatever is treatable there. And if it's not a treatable condition, I've had patients whose condition is fairly terminal, whose condition is irreversible. But if you ask them whether they want to die, most of them, not all, but most of them will hold the view that they still want to live for as long as possible.
Yeah. So you yourself have not had any accounts for a patient who's requesting euthanasia?
No. I've had young patients, I've had very old patients, and all of them would want to live for as long as possible.
Okay. Well, thank you for your thoughts, Dr. Nario.
No problem, Mr. Nario.